to do. I have to pick a medication, things like that. That's where I'm looking at when it comes to interventions. And like I said before, you really will not find a lot of interventions. Let me make sure I'm sharing my screen. Okay, so and truly, what I want you to know is I want you to be able to remember, as she said, most of those questions are about assessing. You get paid to be nosy. Let's just face facts. That's what you do. Assess, assess, assess. And that means is gather as much information as you can. When we get down to the ones where we're able to plan, we're going to plan with the client, never for the client. Okay, and then interventions are going to be medications. Interventions are going to be the group therapies. You need to know like the norming, storming, forming when it comes to Tuckman. Those are the interventions. But again, the majority of the test is at the top. So when it says assess, it says what I do, I really, really kind of say at the top of this chart, very few at the bottom. Okay. So I'm going to using one of my very favorites. It is social work exam services is an old test, so some of them are outdated. However, you know, the ones that are outdated we don't talk about, but I do really like this. This is what we used to do. Okay. So then we're just going to kind of go through and talk about them and talk about how I would answer them and how you would answer them. So please feel free to answer out loud, answer in the chat box. It doesn't matter to me. I just kind of want to know what your thoughts are. Okay. So then I'm going to look at number 1. A family seeks counseling help after the accidental death of one of their 2 children. The social worker's genuine concern over involvement with the family is noticed by the social worker supervisor. The supervisor should what? Okay, this is an intervention question. Okay, it's not a first question. It is, again, let me back up. So first of all, I think they're all first questions. I'm going to ask, gather more information as much as I can. But at this point, the client needs a supervisor. And remember, that's when we go to the supervisor when there's something going on in the relationship, whether it's countertransference or transference. I don't like him. He likes me too much. So those are the things that I go to the supervisor. So what would my answer be to number 1? And feel free, just chat it in the chat box or scream it out. Any of those things would be great. I have a 4. I have a 4. I'll tell you all the time the concept of groupthink. Groupthink is the concept that we're going to agree with the people because we don't want to rock the boat. Okay. So be brave just because everybody says 4. Thank you, Rob. It's 3. Exactly. Okay. So the problem with 4 is anybody. Why is 4 not the answer?
Hi, it's Camila. It's 4 because that sounds like you're doing a little bit of therapy. It's not like you're thoroughly exploring these inner conflicts. It's like you're sitting there in a therapeutic relationship, not supervision.
Exactly. Bingo. And that is not my job as supervisor ever. Okay. So I'm not even supposed to refer them out for therapy. So, you know, you might have some messed up coworkers, but we can't even do that. We're really just supposed to it's about the relationship with the client. All that matters is the client. There's no place for you, your feelings, your values, none of that in this relationship. Okay. So that's why it's 3. Involve the social worker in assessing the effect of his subjective reactions and how they might on the quality of his work and the client. The client. The client. That's exactly what matters is the client. Perfect. Okay. Number 2, you've probably seen this question someplace before. It is actually a code of ethics question. How would a social worker first react to a delusional and disorganized 20-year-old homeless woman who refused to consider hospitalization? What do you do with that? It is 2. How's it a code of ethics question? Why can't I do 1? The code of ethics says if I am not capable of making my own decisions, I lose the right to self-determination. Exactly. And this is so not clinical, but if you've had me in session, what I say is if you're not in your right mind, Yes, I know, not clinical at all. Then you've lost that right to make that decision. I can't hospitalize her because she doesn't meet the criteria for, and yes, safety first. Thank you, Rochelle. If I'm using that chart, safety first. She doesn't meet the criteria for, she doesn't meet the criteria for involuntary hospitalization. She's not suicidal. She's not saying I'm going to kill myself, but nor can I let her go. She's 20, delusion, and disorganized. Can you imagine what could happen to her as she walks the streets of a big city? So I have to keep her safe. Perfect. That's a code of ethics question. You got it. Okay. Somebody asked me earlier about positive and negative reinforcement. That is definitely one of our interventions. So I'm going to go over that again. And that is a difficult concept for most people to get. Okay, so when I'm looking at the questions, what I'm always going to remember is I'm trying to start the behavior or am I trying to stop the behavior? Okay, so the positive is giving and the negative is taking away. But what I want to look for in the question is, what do I want from the behavior? Do I like what Johnny's doing and I want to reinforce it? Or do I not like what Johnny's doing and I want to stop it? Okay, so let's say, school's back in, and let's pretend Johnny actually goes to school as opposed to, being in the kitchen doing homework. He comes home today and he's got a bad grade on his paper, and it's the first week of school, and you're like, Johnny, we can't start off this way. Oh my gosh. So you punish him. A positive punishment is giving him something. What can you give Johnny as punishment? Give me some ideas, guys. What can I give him? I can give him a chore. What else? Yes, not that we would ever do that as social workers. We would never suggest a spanking, but yes, that is it. Rochelle, a timeout is a takeaway. It's a negative. A timeout, and we always say I'm going to give you a timeout. However, it's a negative reinforcement because the goal behind timeout is to take him away from the positives. Okay? I can give him a dirty look, right? I can give him a good talking to. Okay. All of those things I'm going to give him. Okay. Additional homework. Exactly. That's adding to him. So Johnny didn't do what he was supposed to do. So Johnny, you know what now? You have to spend extra time in your room studying. That's giving him something. Okay. The negative punishment's easy. Johnny didn't do his homework. I can take something away. I tell my kids I buy them stuff just so I can take it away. Okay, so what can I take away from Johnny as punishment? Remove. The TV, yes. This phone, yes. His PlayStation, his toys. And you said timeout earlier, his time. Okay, if I put him in timeout, I'm taking away his time from the family. If I'm a school teacher, I can take away recess. All of those things are taking away. Perfect. That's what I remember those. So punishment is stopping the behavior by either giving him something or taking away something. You got it. Okay. Now then, I've got my reinforcement. Okay. So then I always like this one. Your spouse who that you love dearly, who was amazing. They never, ever, ever cook dinner. And you've asked them 1,000 times, honey, I've worked all day and I just need you to cook dinner. The spouse cooks dinner. What can you give them to show your appreciation? Positive reinforcement. You want it to happen again. What can you give them? Yes, you got it. A kiss, a hug. You better go all the way up them stairs to the bedroom, okay? Yes, honey. I like dinner. Thank you, Lenora. Exactly. Exactly. You want it to happen again? You reinforce that behavior. Yes. Exactly. We reinforce that behavior. Okay. Because you know what? If I get something really good out of it, I'm going to do it again. That's human nature. This is Skinner. This is Skinner rewards and consequences. That's how it works. Okay. Now, negative reinforcement. Okay, I'm taking away something. He cooks every night. Whoever that is, yeah, is he available? Shoot, I'm single. Sorry. Okay, negative reinforcement. So that I'm taking away something he didn't like anyway. Okay, so he made dinner for me. She made dinner for me. I'm so thrilled. Thank you, honey. But now I've got to take away a negative stimulus, removing something that they didn't want to do anyway. Give me an example. The dishes, exactly. Honey, oh my gosh, you cook the dinner, I'll do the dishes. I'll wash the car. I'll take the garbage out. One of the ones you've seen sometimes in some of the study guide is the husband, the wife always yells, and when she stops yelling, he does what she wants him to do because she removed the negative sentence. She stopped yelling. Okay, so that's what you're looking for. So remember, in those questions, punishment, stopping the behavior, reinforcement, increasing the behavior, whether I give or take away is the positive or negative. And I think probably, I don't know, in somebody's CDs or videos, it talks about the seatbelt. You get in your car and you're driving down the road, and if you get in the car and you start the car, there's this horrible beep noise, right? Like beep, 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 because the government, they want you to buckle your seatbelt. So then, once you buckle the seatbelt, that noise goes away. That is negative reinforcement, okay? They're taking away that sound to get you to buckle your seatbelt, okay? So that is a Skinner approach. Yes, yes, yes. Okay, so work long hours so I can take one day off. Is that a negative or positive? Is that a punishment or reinforcement? I've come to work all day, every day. Exactly. All day, every day. And I've shown up on time. And my boss says, wow, Pam, you've done amazing. You know what? Take Friday off. Exactly. He's reinforcing my behavior by taking away something I didn't want to do anyway. I didn't want to go to work. So he's removing the negative stimuli, removing, having to go to work. And I'm going to be on time next week too, because I like that. Good, good, good. There we go. Okay, so if we look at number 8, an elementary school teacher placed a disruptive child away from activities for a predetermined, though short period of time. Okay, I know it's not a reinforcement, right? Okay, it's a timeout strategy because she does not like his behavior. That behavior needs to stop. So exactly, I'm taking it away. Perfect, perfect. Okay, good, good, good. Okay. Number 11, again, so this is a diagnosis. My diagnoses are always fall under interventions. Okay, so look at number 11. A client states he's convinced the FBI is watching him and they're trying to influence his thoughts. Okay, Lenore, I'll get to that. This is an example of what? Okay. It is a delusion. It is very much a delusion. A delusion of grandeur is when I think that I am the king of the earth. Okay. A delusion of grandeur is I think that um, many times people with my delusions, remember delusions are thoughts. Those are the ones inside of my head. Those are my delusions. Okay. And my delusions are that, my delusions of grandeur is that, I'm the king. I can walk up and do everything because I'm the king. If you haven't had me before, I do have some delusions. I'm quite proud of my delusions. Anybody remember what my delusion is called? What? No one remembers? I have erotomania. Yes. I have erotomania. Erotomania is when you believe that someone famous is in love with you. Okay. And if you don't know this, Barack Obama is in love with me. He doesn't quite know it yet, but I'm just waiting for him to like leave Michelle, come to my house, all that good stuff. So that's erotomania. So there's different types of delusions, okay? And delusions of eros, that's that Greek word for romantic love. So erotomania is when I believe someone famous is in love with me. Okay, please don't wake me from my delusion. I'm enjoying my delusion, so just let's leave it there, okay? Again, grandiose. Those again, delusions are thoughts, right? In my head, I'm thinking that I'm amazing. Um, Jealousy, again, those are delusions. Different than a personality disorder. Okay. Oh, he's just with her because of the girls. Thank you, Rosa. That made my day. But they're in college already, so I don't know. So he's in love with me for a long time, though, just in case you're not sure. Uh, but so then, jealous, a delusion of jealous is again, those are thoughts. So remember, we've talked about personality disorders. Personality disorders are ingrained. I've been that way the whole time. So if I have a paranoid personality disorder, that's different than a delusion. A delusion is a thought in my head, most often related to schizophrenia, and those are those thoughts. So to have schizophrenia, I have both hallucinations, things I see, and also delusions, which are things that are in my head. Okay, so that's my delusion. Somebody asked me what vicarious reinforcement is. So most often you'll see that through at school, like teachers, my teachers in my room. So I'm going to reinforce somebody else because you'll see what they did and you'll want it. So vicariously is not me actually doing it. I live vicariously through my kids. So if I've got little Johnny sitting at his desk, he's doing a really, really good job. If I reinforce little Johnny, I'm hoping that little Barbara over there will then see what happened and she'll then want to then, behave like little Johnny. So that's reinforcement. Okay. All those terms are always going to go to my behavior people. And remember, my behaviorists could care less about how you feel. If there's ever a question about, changing behavior, that's all that matters because they do not care about how you feel whatsoever. Okay? Look at number 16. Again, that's one of those fact questions. That's a recall question. What's the most common hallucination? You got it. You got it. Those are my auditory. I hear and I see things, okay? And I had someone earlier today reminding you that all 5 of my senses I can hallucinate with, okay? So I can taste things. What's that one called? I taste things. That's called, thank you, thank you, thank you. Okay. Visual, I see things, of course. Okay. And then olfactory, that is when I smell things. Most often, I've worked with clients who have smelt their own skin rotting. They're sure they're dying and they can smell their skin rotting. Gustatory is taste. People believe that their food is being poisoned, so they can taste their food. Okay, auditory. So when you're working with a client and for the test, auditory hallucinations are when you hear things. One of the things that we ask the client is, are those voices coming from inside your head or outside your head? Okay. And then tactile hallucinations, of course, those are the bugs and things that are crawling on me. Okay. So those are my hallucinations. So if someone has things crawling on them and that is not a tactile hallucination, that's called excoriation sometimes. Trichotillomania is pulling your hair. That's a disorder, an anxiety disorder. Excoriation is pulling my skin. So I'm pulling off like the hole in my skin, but it can't be drug related. Okay. Okay. So we talked about this a little bit last week. If you were in class, I'm looking at number 22. We talked about our family styles. We talked about systematic. We talked about systematic as well as structural and strategic terms. So look at number 22. Anybody who can recall that? According to Don Jackson. And again, when you see those names on the test, you don't have to know the names. You really just need to know enough of the information to gather the information. Okay, a pattern of pairs or set of messages that are different levels, but closely related and sharply incongruent can occur with other messages that diminish the awareness of the incongruence and its ineffective handling. This describes the theory of what? That's a lot of words, isn't it? And a lot of my clients have even difficulty just establishing what it's asking me. Okay, so according to the question, I'm looking at a pattern or a set of messages. So I've given you a message, I'm going to give you another message, that they're different. Okay, they're closely related, but incongruent. Incongruent means they don't match up. Remember, if I am doing one of the terms we look for in working with clients is congruency. If the words that are coming out of my mouth match my body, that's congruency. If the words that are coming out of my mouth do not match my body, I believe the body, right? Because as Shakira would say, the hips don't lie. Okay, but the body's not going to lie, the mouth may. Okay, and yes, that is a double bind. A double bind. Someone give me an example. All my lovely people who know. Come on, give me an example. What's double bind?
Um, I can explain best of my knowledge. Can you hear me?
I can. Who is this?
This is Sophia.
Yes, Sophia. Please share. Thank you
So,
for being brave.
double bind is something that you say something, but you believe in something, but your actions show something different. So, like you're basically contradicting yourself.
Close, close. You get my bell. Close. So a double bind most often is me telling somebody else. So that's a family technique, a family. And so if it's Don Jackson, is it strategic or is it structural? Anybody know? It's strategic. Remember, strategic has to do with the conversations, the communications. That's a strategic term. So a double bind is when I tell someone to do something, and then I expect something different. So I think I only have one male in the group today. Women, we oftentimes put our husband in a double bind because we will ask him something, and then he will tell us, and then we'll tell him he's wrong. Okay, a double bind is like you can't win. So, I tell my kids that education is the most important thing. You've got to get to education. You've got to get an education. But then at the age of 16, I say to him, I need you to stop working and support the family. So, but you're still giving a hard time because he's not making the grades. So double binds are communication techniques that you just can't win. And we do it, and that's what families do, and that's a strategic family approach. Thank you very much for being brave. Appreciate that one. Okay, I used the word equal finality earlier. Again, so equal finality means that we end up at the same place. So we start off at different places, okay, but all of us will be licensed social workers at one point in our life, okay? It might have taken us different roads, different amount of times, but we're all ended up at the same place. That's equal finality. Okay. Okay, again, 23. So these are we're looking at the interventions, the treatments. So I know that all of my personality disorders are ego syntonic. What does that mean? So personality disorders are ingrained in who I am. Okay, so we don't diagnose them until you are the age of 18. But if you ask their parents, they will tell you all the time that they've always been this way. Okay, you got it. Okay, so anyone who's taken the test before, have you ever seen them been put in clusters anymore? I was going to say, I don't think we do that anymore. So sometimes when you study, we'll see them in clusters, but I'm pretty sure that we don't put them in clusters anymore. I didn't think so. Thank you much. Thank you much. I'm old, So back in the day, we put them in clusters, but I also think it's kind of a really easy way to learn them. So if you want to put them in clusters, that makes it a little bit easier. So personality disorders in general are ingrained. You've been that way since birth, but we do not diagnose them until you are 18. So what I know is, and again, you don't have to cluster them, but it's easier sometimes to remember them in clusters. So my cluster A are my weirdos. Sorry, that's, clinical term. Okay, my paranoid, but the personality disorders, they are ego syntonic. That's the word. They're in sync with who they are. They've always been paranoid. I hope my family never watches my videos, but I have a brother that's a little bit paranoid. Okay. Um, um, Growing up, he was always sure that, something was going to happen, always out to get him. I don't know. So yeah, I won't discuss that. But so he's always been paranoid, though, always, always, always. But you don't diagnose that until you're 18. So it's not like paranoid where he's schizophrenic paranoid. It's just paranoid that he thinks people are watching. He thinks people are always listening. He thinks that, that the man is out to get him. So that's his personality. So he doesn't have a problem with that. So he's not going to come for treatment because they're ego syntonic. This lovely one, of course, is my schizoids versus my schizotypals. Okay, so what's the difference? Yes, Rosa, you always have to watch your back because somebody's always out to get you. You got it. You got it. My schizoids love COVID. You probably have someone in your neighborhood who is schizoid. You've never seen them. They come out to get the mail, but they're not going to speak to you. That's the house that, back in the day when we did trick-or-treating, you never went to. And not that they were mean, they just didn't want to be bothered. Okay, the grass might have not been cut. They might not have, come out to get the mail during the daylight. They just don't want to be bothered. So we're not on a schizophrenia. We're not schizophrenic, right? But our personality has always just been a loner and likes to be a loner. They're not looking at anybody else in their life. Schizotypals, those are the ones that are a lot weird. Okay, if you can see that, always keep some toast in your pockets. Okay, but again, they do not meet the criteria for schizophrenia. They've just always been weird. When I first started my career, we'd use that term FAK, funny acting kid. I know. Again, not clinical, but those were the people who were, brooding to be schizotypals. And we don't diagnose those until you're 18. Okay. So then when it comes to my others, my next category, I'm looking at my antisocials. Okay. My antisocials, not someone who knows, some of my new people. Are antisocials just not friendly? They are very friendly. My antisocials love to have you over. They'll take you out on a date. They'll stab you. They'll murder you and leave you in the back of the car and then blame you. So my antisocials are not anti-people. They love people. They just want to kill you. Thank you. Yes, eat your liver with some. What's that? With some. What do you say? Flava beans. That's Silence of the Lambs. Exactly. Exactly. Thank you. Exactly. So those are my you don't okay, so that was the question is how we treat personality disorders. Okay, so how we treat personality disorders is to make the ego syntonic ego alien or ego foreign to their ego. So let's back up with my antisocials. So we don't diagnose those until 18. However, we do know that, many of them were diagnosed with conduct disorder when they were younger. That conduct disorder is from 6 to about 13, 14. You have to be diagnosed with that as a kid. Thank you. Okay, killing animals, having no remorse. So we do believe that conduct disorders can be treated as they're younger. My 3 and 4 year olds, if you've got a kid who's poking the dog's eye out, you really introduce him to empathy, and that dog hurts. So there are lots of things we can do at that age. However, once it's a personality disorder, then they're not coming for treatment. And many times with my antisocials, we're just maintaining them in prison so they don't kill anybody else. Okay, those are my serial killers. Those are my antisocials. If you've ever had a borderline, you know, if you've spent 20 minutes with a client and you have spent 20 minutes with a client and you feel crazy, they're borderline. The borderlines have had 17 therapists before they came to you. All of a sudden, oh my God, you're the best therapist ever. You're so amazing. You've answered all of my questions. I love you. I love you. I love you. However, the next time that you show up late or do something different, thank you. Exactly right. They do not, they really are done with you. They're known for their unstable relationships. They're not able to regulate their moods. And you're absolutely right. That's what DBT came from. So DBT is really about teaching you how to stabilize those moods. And it was actually used, invented for my bipolars. We use it now, of course, with children as well. The term mindfulness came from DBT. Okay, that's my dialectic behavior therapy. And it really is about learning to control your emotional regulation. Okay, there we go. Okay, so I don't think you'll see the DBT question on my LCSW, but definitely, I'm sorry, my LMSW, but on my LCSW, you might see it. Okay, so that is mindfulness, being aware of the moment, breathing in that moment, learning to regulate. Oh, Rosa, thank you for sharing that. That was on that. Very cool. Thank you. Okay, learning to regulate your emotions, learning to tolerate distress. All of those things are part of DBT, and that's the problem with borderlines. They are known for not having stable relationships. When things get tough in a relationship, they just run. For the test, borderlines are almost always women. Okay, I don't know that. Marcia, I don't know that. You have to, I don't know. Oh, Marcia. What is, I don't understand. Oh, Brady Bunch. That's where you're going. Okay, understand. Sorry. Sorry. Okay, I'm slow and old. Oh, I don't know that then. What do you mean? Tell me. Just unmute. I have no idea.
I meant Marshall Lanahan, the creator of DBT.
Thank
That's
you.
Why I
Okay.
Marshall.
Okay, gotcha. Thank you. Thank you. Thank you for sharing that. I'm like, what? Okay. So again, so that's my treatment for my borderlines. Okay. So back to that clue then, I have my histrionics and my narcissist. For the test, almost always my narcissists are going to be men. My narcissist has low self-esteem. Despite how they pretend, they do have low self-esteem. And my histrionics, I always say to my girls, my females, if you do not know the histrionic, the person in your girlfriend group, it is probably you. Okay, so they're the ones who demand attention. They are not promiscuous, believe it or not. My borderlines will sleep with you in a heartbeat, but my histrionics really don't. They're my drama queens. Get my there we go. Okay. Of course. So she's got on the tight dress. My husband was narcissistic too, but I can't help that. So, but yes, drama queens, they want the attention. And it really is. And you will see them that, remember, personality disorders do not change. So you'll grow up and you'll see the older women who are still the same drama queens. My neighbor was 96 when she died. And I promise you, she was still out there every day when she'd go to the grocery store. She put on all her jewelry, on all of her makeup. And the world needed to stop because she was going to the grocery store. So those personality, unless we're treated, are totally ingrained. Okay, so then my histrionics for the test are going to be women. My narcissists for the test are going to be men. Okay, my narcissists they're not going to walk in the room and demand that attention. They feel like you're very lucky to breathe the same air that they did. Okay, so back to that question though. So one goal in treating a person diagnosed with a personality disorder is 3. I need to make the ego syntonic trait ego alien. I need to make it uncomfortable because right now they're very comfortable in that, and I need to make it uncomfortable. Okay, when we attempt to treat my sociopaths, what we try to teach them is empathy, to understand that they hurt someone, because most often they're not even capable of that. Okay. 25 is a typical question. Again, we're looking at interventions. Okay, so we're not looking at our normal assess. These are my interventions. So look at 25. Okay. So then, I'm going to the neurologist already. Okay, so let's rule out. I'm not going to offer the client aspirin, right? I missed that day in medical school. Okay, change the treatment modality. Not going to do that either. So again, I'm going to refer my client to a neurologist. Safety first. That goes up to that, making sure they're safe. We can spend hours and hours and hours working on things, but safety first. Okay. Okay, good. Ruling out my medical. You got it. Okay. Okay, 35, again, that is probably one of my, the terms we talked about in the past. 35, in social work settings, a researcher would describe the interchange between the social worker and the client as what? That's a systems term. So what am I inputting? Throughput. Thank you. It's 1. We're in the same system. The researcher and the researcher would describe the interchange between the social worker and the client. Okay. Look at number 51. The social work method that is least like the others is, again, these are interventions. Okay, so these are the types of the orientations, the things that I would do to intervene with my clients. 51, which is one of these is not like the other. Okay, so problem solving is certainly, that's what we're doing now, is using the problem solving method. My crisis-oriented brief treatment. Does everybody know the crisis plan, the crisis intervention model? It is in the APGAR book, okay, but you will see questions on making sure that you know kind of what happens next in that crisis intervention. So I'm just go that just a moment. TERBN. Crisis intervention model. Okay, so this is in the APGAR book, and I've always, it's been on the test, and most often they'll ask you, what do you do next? Okay, so this is one of the ones that you really need to know. Again, it is an APGAR, however, it doesn't look this way. It does look like it's written out. So this is one that you need to know. So this model actually came to be after we had the major school shootings and all the other good things that have happened in life. And the goal was that whether it's the policeman or the fireman or anybody else, that we would all be on the same page. Okay, so you really might get one that says, what do I crisis assessment. The assumption with the crisis model is I will never see this client again. I'm just there for the crisis, maybe 20 minutes, 30 minutes on a good day, and we're done. So just remember that. The question about what happened in childhood is never right on the crisis intervention model. What I want to do first is plan and conduct a crisis assessment. I am not pulling out my clipboard and asking them all this information. Are you safe? There was a school shooting. Someone just attempted suicide. There was a bombing. It's a crisis. Okay? So if you've ever been in any of your areas, the code of ethics says you are supposed to volunteer in a crisis. Tornado, hurricane, any of those things, you're supposed to be there. That's what the code of ethics says. So plan and conduct a crisis assessment, okay? You get there, we're kind of like, is everybody okay? Is everybody physically okay? 2, establish rapport. Hi, I'm Dr. Pam and I'm part of the crisis team. Okay, what's your name? What's going on here? 3, identify the major problem. I'm trying to get as much information, as many details as I can get about just what happened. Did you hear the shooter? What did he say before he started shooting? Did you know the guy? Have you ever seen him before? All the information, because once I hit step 4 and ask them with their emotions, they're a hot mess, right? I'm done. I'm done. Maybe that's just me, but I'm a hot mess. If you can hold me together until I can deal with the emotions, I can give you some facts. 5, generate and explore alternatives. That's usually, wow, do we need to call your mom? Have you had a crisis like this before? What did you do last time? Gathering all that information that I can, okay? 6, formulate the action plan. Most often the action plan has already been formed. You're just going to follow through. Okay. So once we leave the building, we're all going to meet at the school. Your parents will meet you here. This is what's going to happen. There's a plan. There's someone at the school who'll take care of you. The crisis team will be there tomorrow. All of those things. And 7, follow up. But again, I'm never going to see them again for the question. So the follow-up, most often I'll give my business card and I'll say, hey, you know what? If you're not able to hook up with your crisis plan or the crisis team, give me a call. I'm not treating them. I'm just going to make sure I can hook them up with who they're supposed to be with for that treatment plan. So you need to know that crisis intervention model, because you will see that on the test and you'll see the steps. So I did this and this and this. What do I do next? And this is the one time you're not following that problem-solving model, right? You need to follow this step. So if it says in a crisis, what do you do? That's exactly what you do. Okay. So then the social work method that is least like the others. Okay. So then the one is preventative, right? Because everything else is going to happen after I have there's a problem. Okay. Let's look at 59. Again, that's just a recall question. That's one of my good Freudian questions. When a client recalls a previously forgotten painful experience, the emotional release that results is called what? What is that called? You got it. Ah! I'm letting go of that emotion I've held together for so long. Ah! And I got to let it go. That's definitely catharsis. Okay, free association. I say cat, you say, oh, I'm sorry. Thank you. The bell. So cat, dog. Free association is a Freudian term. It's actually a Carl Jung term, but it's a psychoanalytic or psychodynamic where you say the first thing that comes to mind. Remember, Freud think everything was unconscious. So when you say the first thing that comes to mind, that's letting go of your unconsciousness. When I think of flashback, what diagnosis do I think of? If I'm having flashbacks, what would you diagnose with? Yes, PTSD. Okay, Rosa, I'm going to challenge you again. PTSD starts at 30 days. So from 3 days to 30, what's my diagnosis? Brief. It is brief, but there's another word for it. It's not psychotic. Acute stress disorder. Yes, Sophia. Yes, acute stress disorder. Something happens. Something awful happens. My husband dies. My wife dies. Something awful happens. So that first 3 days to 30 days, it's an acute stress disorder. It does not become PTSD until after 30 days. Good job. Yes, look at you. Okay, 59, sublimation. That is one of my defense mechanisms. What does that look like? It's an example I always use, and you're probably none of you are old enough to tell my kids. That's that really, you remember those really big like albums that were CDs that were called albums, those really big ones? Back in the 70s, I know, that devil worship music, it was thought that if you played it backwards, there were some hidden messages because you couldn't really sell that album with all that devil worship music on it. See, but the flip side, if you played it slowly and backwards, you could hear it. So sublimation is when I have feelings or thoughts that are not appropriate for society, so they come out in a different way. Okay, so most often you'll see the question, if someone has an issue with being underweight and dieting and maybe even a little bit anorexia, and suddenly they're a personal trainer, no one's going to say a thing, right? Because that's appropriate. That's what you do as a personal trainer. If I really like the feel of like flesh in my hands, like I feel like that human flesh, if I'm a surgeon, you're good, right? No one's going to say, well, a butcher, say a surgeon. Exactly. Channeling inappropriate feelings into a more acceptable behavior. Perfect, perfect, perfect. You guys are amazing. Look at this. Okay. Let's look at 62. This is transference. Transference is neither good or bad. It just is. Okay. Freud sometimes called it the extra helper in the room. So we can have a negative and we can have positive, but the thought of transference in general just is. Okay. So 62, the client's transference reaction usually relates to I'm looking at 62. What is my answer? The client's ability to transfer learned experiences to another. Not quite. Not quite. The client's transference to observe his feelings in other people. Okay. It is definitely his issue with being able to, okay, I'm distorting my perceptions because of past experiences, and that's the key to transference. You remind me of someone in the past. You remind me of someone that I used to know. Whether I like them or not, you're bringing up some history there. Okay, good, 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 guys. Okay, let's look at 65. Again, we're only on interventions today. A social worker who uses behavioral techniques would be least worded a bit weird. I have no idea what that says. Words a bit weird. Is that what that says? Yes. So that's the goal of practicing the test, though, because if anyone's taken it before, the words are a bit weird, aren't they? The sentences could be like written so much easier, could they not? And it's purposeful. It's very purposeful. They want to know if you have those higher level thinking skills. Okay, so let's look at 65. A social worker who uses behavioral techniques would be least interested. Remember, my behavioral people, that's going to be my Skinner or my Skinner or Pavlov. All they cared about was changing your behavior. Okay, so who would be the least, if you'd be the least interested in what? I'm going to get 65. Oh, I would do a contract. Yes, Latoya, yes. Feelings, social relationship. I don't care if you like me. I don't care if you ever see me again. Behaviorists are never caring about your feelings. Okay, so if you think of a behaviorist, if you look back at like Watson trained little Albert, and he made that baby like freak out. That's that was really strange. But what he talked about is that's how we train animals. If we thought of people as animals, it's consequences and reinforcement. Okay, that's all that matters. So if you go to see a behaviorist, and my mother died last week and I just can't stop smoking, I don't know what to do, he wouldn't care. Stop smoking. That's it. So behaviorists have no room for feeling. It's only about stopping or starting the behavior. So when you're looking at the terms, the test, and they're asking about a behaviorist, there's no place in there for that relationship. None at all. Okay, good job on that one. Okay. So then, let me see here. Oh, look at 69. A young single woman with serious stomach ulcers asked the social worker's advice about renting an apartment so he can live away from his family and move more independent. The social worker should. What should she do? Are you suggesting to me that a should question is still a first question? Yeah, a should question is still going to be a first question. If there's any way I can gather more information. Okay, exactly. Someone, and one of my clients before said a should question always had to do with the code of ethics. All of the questions, if we're looking at, following the social work model, they're always about getting as much information as you can. Today, I purposely focused on interventions, but I promise you on the test, you're not going to see a lot of interventions. What you're going to see is, what do I do first? What do I do next? So as you see, you have to have some information. You have to have some content, but you also have to know what we do first and next. Okay, so I want you to remember, if you remember who's taking the test soon, coming up soon, just some rules in general. Please don't change your answers. Don't change your answers. If you thought that's what it was the first time, do not change it. I have never had a client come back to me and say, "Wow, I changed 6 answers, and I'm glad I did." No, if you don't know it, flag it and come back to it. Okay. So then, most often, also, you're going to find something later, and that maybe it rings that bell. Like, oh yeah, I know what that is. I also think in general to skip the first 3 or 4. I do. I just think that sometimes if I don't know those first 3 or 4, that's setting up the whole like panic that sets in, and I'm not going to do well. So just skip them. Just skip them. Start. I had a client before who told me she just started at the back. So you know what? Hey, that's fine too, because you can skip through and just start at the back. Either way works for me. But don't change answers. Okay, I hope I can't be with you on the test. I can't, but I do want my voice in your head. I'm sorry. You can let go of my voice when you're done. You can, but I want my voice. The person who's coming next week who passed, she said to me, she goes, I kept watching your videos and I kept hearing that dang bell. So every time I took the test, all I heard was the dang bell. So that's what I want you to know. Good job, good job, good job. Remember, for the test, you're the very, very best social worker out there. And really, guys, you are. This test is really not about, what a good social worker you are. It's not. It's not. It's about learning to answer the questions the way that they're looking for you to answer. That's it. That is it. Okay? It's not a make or break deal of whether you're a great social worker. Okay? So that's not true. You're not powerless. You're not. It's a matter of learning how to answer the questions the way that they're looking for. And if you've tutored with me individually, I'm going to tell you, don't bring in your stuff. Don't say one word about your head. It doesn't matter what you do every day in that world. All that matters is in those stem of the questions. That's all that matters, okay? And you can learn how to pass this test. And I think all of you know people who have their license who maybe shouldn't, right? Okay. I thank you all for being world changers. It means a whole lot to me that you take your time to give back. You could do anything you wanted to in the world. You're the brightest people ever, and yet you chose to be in a profession where you give part of yourself every day. And I really appreciate it. Okay. I'll see you next Sunday. If not, if I have you individually, I'll see you individually. If I missed you last week, I had a really rough week. I do apologize. And I thank you all, guys. Thank you, thank you, thank you. Thank you for being world changers. And remember, this video will be here and you can watch it for 30 days. And if not, go to the YouTube channel. Bye.